you very much. We'll now turn to Natasha Bilimoria, who's the director of the U.S. strategy for Gavi.
Thank you. And I just want to thank everyone for being here, but actually really thank oh, great. And is the deck up? Well, it's going up. Just to thank everyone for being here, but also to the National Academy for putting this together. I think we can all agree that it's an interesting time, and we're about to enter into an interesting era in the U.S. And we at Gavi are obviously thinking about how we're going to manage that, but I think it's a great opportunity for all of us here doing all we've done in global health to actually have the opportunity to think through some ideas moving forward, because I think the biggest thing for me is I think it's really important that we maintain the successes we've had, and they've been a lot, and maybe if we're lucky actually expand on some of them. So I just want to start out quickly. I'm not sure how much everybody knows about Gavi, but I just want to take a few seconds or a few minutes to talk through it. So we can just step back several decades ago into the 1970s, and that was really a period where the world was really coming together to try and get basic vaccines to poor countries around the world. And in spite of all those efforts, there were increases in coverage, but not at the level we really wanted to see it. It was really around, the 70% mark in the 1990s. And at the same exact time, we were seeing some pretty amazing new vaccines coming into markets in the rich world, ones that had a massive impact on child health and child mortality, which was obviously critical for countries like the United States and countries in Europe, but obviously just as important, if in some cases not more important than what we needed in the developing world. But the problem is that there were no recognized markets at that point. I think the manufacturers didn't see a market there, and therefore the prices stayed very high and therefore remained completely out of reach for a very significant part of the population in the world. So in 2000, the key leaders in immunization, UNICEF, WHO, Bill and Melinda Gates, plus donor countries like the US government and the private sector, and civil society really came together to create something called the Global Alliance for Vaccines and Immunization, Gavi. And the goal was pretty simple. It was just to ensure that new and underused vaccines got to kids living in the poorest countries around the world, which is where 85% of unvaccinated children live. Our model is, I think, innovative. First of all, we support 12 different vaccines in over 70 countries around the world. And we do this, again, by not replicating efforts of partners, but what we're really trying to do is bring together all the key players in immunization, both public and private, and creating an alliance. And with the countries in the middle of our work, really the central force of our work, we work with all of these partners to ensure that vaccines are being procured and delivered in the most efficient way possible. And it's important to know that outside of a very small office that I run here in DC, Gavi is based in Switzerland and there are no country offices. So we really depend on both our partners who have country presence, but also around the systems in country to make sure vaccines are getting to the people who need them. So really our model of partnership is a public-private one, where the sum of its partners we are able to take the sum of the partners and really take advantage of that, because no one player can do this alone. I don't know why this is not working.
Not sure.
There we go. So our successes to date, I think, have been quite strong. Since our inception in 2000, the Alliance has immunized 580 million children around the world, saving 8 million lives. And we hope to do more in this next strategic cycle, which started this year and runs through 2020. And we want to continue doing the work that we've been doing, but we also want to expand our work into really ensuring that we're getting the kind of coverage rates and equity rates that that we need to see in these countries. It's not just about getting the vaccine in the country, it's making sure that all children have access to that, regardless of how vulnerable or how difficult it is to reach the place where they live. And so we hope to immunize 300 million more kids in this period, which would save an additional 5 to 6 million lives. And if we're able to do that, we would have prevented 100 million cases of vaccine preventable illness and save anywhere between 80 to 100 billion dollars, averting different costs related to illness, like decreased productivity, disability, and treatment. So, and lastly, just on this point, is that the world is really experiencing the highest level of immunization we've ever seen. It's 80% in Gavi-supported countries on average, and we do feel that by working together and pushing ourselves, we will be able to see that number go up in by the time 2020 rolls around. So I want to spend a few minutes now talking about financing. So there's two pieces of this. There's the money that really comes into us, and then there's parts of our model that I think really impact the way we finance. So as far as the money we bring in, like many other donors, we get money from the major donors, major governments around the world, United States, the UK, Bill and Melinda Gates Foundation. But we also, which I think is unique, have several innovative financing mechanisms that also provide financing to the organization. And two I will talk briefly about are the International Finance Facility for Immunization, or IFIM, and the other is the Advanced Market Commitment. And through these kinds of mechanisms, we're really able to create a long-term and predictable set of funding, both really to support the countries that we work with. And then as far as our model goes, there's two areas that I think lend itself to financing. The first is around market shaping, and the second is around co-financing. So this slide gives you an overview of our overall picture of donor contributions. So fortunately, to date, our story has been really one of steady growth over the last decade and a half. And I think what we've seen over this time is that the world has really recognized the importance of immunization, and that is a very positive thing. We had our second replenishment meeting in January of 2015 in Berlin, where donors came together and pledged over $7.5 billion for the period between 2016 and 2020 to help us achieve the goals that I mentioned earlier. I just want to step back for 1 second and talk about the U.S. As I said, the U.S. has been a huge supporter of Gavi, was there from the very beginning, and it's been an important partner both financially but also programmatically. But I think it's really worth saying that in this last replenishment period, the U.S. really stepped up. It provided $1 billion, or pledged, $1 billion over a 4-year period of time, which was almost a doubling from what they did in June of 2011, and I think Amy would probably remember that. But it's important to realize, and I think everyone in this room knows about the fact that the U.S. doesn't fund multi-year pledges. They do it on an annual basis, and we've had incredible support from the administration and the Congress, and we've had 2 of those years fulfilled. 2017 is a question. I think we're all sort of waiting to see what happens with this budget cycle we've all been working on for the last year, and that obviously could have an impact on what happens in 2018. So it's something that we're obviously looking at and working on very closely. The 2 innovative financing initiatives that I talked about, the first is IFIM, and it was established about 10 years ago, and it really provides an opportunity for donors to provide long-term funding to issue vaccine bonds on the capital markets. And what we're able to do with that is, again, donors pay for this over a period of time, but Gavi has the cash available up front, and so money can really be front-loaded and then converted into financing to support the needs of countries at that time. So the point here is to have that flexible funding when it's needed and not just when it's available. That's really critical to ensuring that we're able to have the kind of impact that we need to have. The second is the advanced market commitment. Some of you may know what this is. It's a simple process. Donors commit money and tell manufacturers that we need a particular vaccine with this product profile that would work in the developing world. and they commit dollars to it. Manufacturers see those dollars available, understand that there is incentive to create that vaccine in the right way, and the deal is that then they provide that vaccine for a lower price over a longer period of time. And the benefit really goes to Gavi and the developing countries because we can purchase those vaccines for a significantly lower price over a period of time, and it allows countries also to plan their programs because, again, this is a longer term situation where they also have some predictability in the vaccine being available. Quickly on private sector, I think we all hear a lot about this right now, and we've talked a bit about, or I've talked a bit about how we worked with the vaccine industry, but we've also fostered relationships with other areas of the private sector, and I think that this is going to be an important part of the way forward. And there's multiple ways of doing this. There's the obvious financial resources that the private sector can provide, but I think what we're also seeing in our work is that the private sector actually can fill some of the gaps that we are seeing in access to immunization. And as I said, we've accomplished a lot in introduction, but as we look at coverage and equity, we've really got to think of doing things in a different way. And I think we've had some experience with private sector entities and are continuing to do more to really figure out how we can use their skills to really benefit the work that we're all trying to do around immunization. Market shaping. So basically, the primary responsibility of Gavi is to procure vaccine and therefore be a market shaper. We buy vaccines for 60% of the world's annual birth cohort every single year. So we have some pretty powerful purchasing power. And because we buy in such large amounts, we're actually able to really drive down prices quite a bit. And also what we've been able to do over time is attract new manufacturers to this space. So when we started in 2000, there were only 5 manufacturers making vaccines that we were supporting, and they were all in the industrialized world. Now we have 16 manufacturers, many of which are in emerging markets, India, South Korea, and China. And then the last piece of our model is around co-financing. And I understand that there was a lot of discussion this morning around domestic resource mobilization, and this is something that has been a part of our model for a number of years. And the idea here is that every country that receives Gavi support really needs to provide some level of their own financial support for the vaccines that they get. And that's every country, from the poorest to the ones that are, moving up the economic chain. And it goes through different processes. And as a country's economic state grows, they will take on more and more of the responsibility of the vaccines until they hit a certain point where they've reached the level of GNI, which is our cutoff. And actually even before that, we are working with these countries to really ensure that when they transition out of Gavi support, that not only will there be the fiscal space to afford their immunization programs, but we also want to make sure that the systems are in place to ensure that the coverage rates stay up even after graduation. And this is a very critical point for us. And this is the cycle where we're going to see it, because as you'll hear in a few minutes, we're actually expecting 20 countries to graduate, up to 20 countries to graduate in this next period. And co-financing will be a big part of what we get into Gavi. We were at about 500 million in our first strategic cycle, in the last strategic cycle, 2011 to 2015, and we expect that could go up to $1 billion in this next period. We talked a little bit about graduation. Again, this is a big part of what our goal is, and I think we're hearing this in a lot of different areas of health. Global Fund is talking about graduation and transition, lots of countries, and so I think collectively we need to be thinking about how countries are dealing with this, because it's not just one set of funding going away potentially, it's many areas of funding. But we've had 4 graduate that will graduate by the end of this year, and they're on the screen. And what we're actually seeing is that they're introducing new vaccines on their own now, which is exactly what we want to see. And as I said, we expect that there will be up to 20 countries that will graduate in this next period. And then lastly, just stepping back to sort of where we started, I think that we don't have a lot of information about what this administration is going to do in this area. But I think we have to remember, and it's really hard for anyone to ignore the success we've had in global health over the last 15 years. And I think we have to talk about those accomplishments and encourage our supporters, both in that remain in Congress, to continue supporting us and actually work to educate others. I think there's been huge bipartisan support over the years, and we need to make sure that that continues and grows, and really work to ensure that people understand that providing continuing U.S. support for global health is in the vital interest of this country. Just a few recommendations around financing. I think the biggest one is the U.S. needs to continue doing what it's been doing. It plays a leading role in financing, but it's also a leader with other countries, ensuring that they too are seeing global health as an important piece to be investing in. And I also think, again, that we need to be looking at how and where the private sector can appropriately work with us to move us to the next steps that we want to get to. So, again, happy to take any questions, and thanks for the opportunity.